I'd like to talk to you about introducing a relatively new product called PainAway Post-Op Laser. This product is an extension of your practice, an extension to help patients that have chronic pain or a patient who is just an acute post-op patient. Let me talk to you about the difference of the two. After a patient comes into my office and went through my protocol, I sometimes need to give them something that they can use. Or if a patient is leaving to go on vacation for 2 weeks and we're in the middle of a program. What we have here, this is an OTC unit called PainAway Post-Op Laser, and we're able to teach the patient how to use this at home to further their laser treatment in regards to absences or if there's a loss of treatment time. Or if we have a patient that is in chronic pain and needs subsequent laser therapy without having to come into the office. I have some patients that are very difficult in ambulating, they're in wheelchairs, so on and so forth, and this is a perfect unit that I can send home with them. They can treat themselves. There's an agreement with this that it's actually a rental agreement between you and the patient. They sign the rental agreement. You can determine what the price is that you believe is fair in your geographic area and be able to send this home with the patient for an extended period of time. It could be anywhere from 3 to 5 days to 30 days to use. Actually, I have a lot of patients that might use this instead of using a TENS unit. The thing I like about using the PainAway Post-Op Laser is we know it's this not decreasing the pain going to the brain. We know that is ongoing therapeutic effect to enhance those tissues to continue the road of recovery. So that is one way that you can use it when patients are going to be out of your office in the middle of treatment or for extended time. The other important way that you can use this in your practice is if you do have a patient that, for instance, is having a total hip replacement or total knee replacement or a partial knee replacement or a shoulder surgery. It doesn't even have to be a replacement. We know that the research clearly shows how laser therapy inhibits the TNF-alpha fibers and the interleukin-8 fibers that causes pain. So we want to keep the pain down, and we want to diminish the ability or diminish the scar tissue formation within the patient. This is something that they can use immediately after surgery. I have used laser therapy post 1 hour or 2 hours after the patient had surgery, and the improvement is profound. The surgeons look at the patients and they're in awe on how well the patient responds in range of motion, the decrease in pain that they're having, and also the decrease of edema and swelling in the region of the surgery. It prevents the buildup of keloids. So this is very, very valuable. If you have a good patient that has no other choice but surgery, this is something that you can rent for them. They will use it at home, and you can teach them how to use it. It's very simple, extremely safe, and is FDA approved for home use.